Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $2 million mark and beyond. Okay, so I'm going to go over a few of the days, kind of like last time. I'm going to go more over just the MVP patients, and I'm going to tell kind of something that I'm kind of working on here. So one of my challenges, this is a Wednesday, one of my challenges I realized is my Westboro is a little bit lighter than my Worcester office, basically because it's not as busy as an office because it's newer. So I'm trying to send more Shockwave procedures and more other types of patients over to the Westboro for like procedures and things like that, just because it'll be a way to have patients go there, see what the office is like. It's actually a nicer office, so this is something that I am actively doing, and I'm actually having my staff. I know that staff always offers that, but I find when I offer it, it tends to work a little bit better. Okay, so the MVP patient of the day, this is a patient with a left posterior tibial tendon dysfunction. They did an orthotic, and I also set them up for 6 out of 6 Shockwave, and we are checking on the insurance for doing an AFO for this patient, so this would be a really good patient. Other patient, there was a patient with bilateral PTTD and some lower back pain, so that was another orthotic. And then another good patient, there's an orthotic. 1 year follow-up, continues to have a little bit of pain, and they wanted to do another orthotic. So they had one orthotic, they wanted to do the second pair of orthotics. I find when they come into pickup, we have this discount. If you haven't heard this before, I have a little sheet I give them that says, hey, you can save $200. You have whatever, 90 days or something to get a second pair of orthotics. It doesn't cost us any more to do that. So those are some good patients. Okay, a couple of other kind of pertinent patients. There was a patient that did Shockwave number 1, and he had nerve pain. So he had a previous nerve surgery on the medial heel, kind of like for a Baxter's nerve decompression or a spur resection. Never really got better and has this nerve pain. So he's tried different types of lidoderm patches and things like that. But he is going to do 3 to 6 sessions of Shockwave to help kind of calm that nerve. We tried in the past hot laser, like the Cutera laser. It helped a little bit, but I'm hoping that the Shockwave is going to help even more for him. Another patient that was a good patient with a Shockwave was his right foot pain. After 6 out of 6, so they're not feeling much better after it, and we ordered an MRI and PT for this patient. Another patient this patient had we set up for this patient a flexor tenotomy. So that'll be a good one. Those are always fun ones to do in the office. Another patient that had plantar fibroma. She had finished 3 out of 3 Shockwaves, and she's going to come back in 6 weeks. Why 3 only? Well, because she had 3 in the past, and that's what she was used to. Another patient was number 2 out of 6 for Achilles tendonitis. Okay, and then the other one was a soft tissue mass to the medial bunion region. I'm going to do this in the Westboro office, but this is the one I told you about if you listened to my previous podcast. She didn't show up for the procedure. She got sick. It's not her fault. Okay, next was a Tuesday. The MVPs, this is a third opinion for a bunion or right tibial sesamoid pain. And because of this kid's a student, so we're going to set up 6 sessions of Shockwave. I did look at the MRI. It had bone marrow edema in there, and we're going to try to do this every 3 days. So this is an MVP patient because a third opinion, cam boot, even up, and doing the Shockwave. And he's going to do it quickly because he's a student, so like I said, every 3 days. Next patient that was an MVP, this was a left ulcer, so a right ulcer, and this patient got the collagen. So I tend to find that anytime I do the collagen, it tends to be an MVP patient. My least valuable patient, once again, reminding you, is fracture follow-ups, so I tend to put those in 10-minute slots. And then there was another patient that came back for a right hallux nail sample, and we did an avulsion, and we're going to plan on doing a staged onifix. So meaning they do an avulsion, because it's usually like a wavy, detached onycholytic nail and only attached to the base. Was negative for fungus, so we're going to do an avulsion. And then they're going to come back in 3 months when some of the nail grows back, and we're going to do an onifix to help it to normalize a little bit. Another patient was number 5 out of 6 for plantar fasciitis. And there was this kid I've talked about multiple times, number 5 out of 6 for bilateral severs. He is better now for that. And then this patient, it was a follow-up. I just like to tell you the successes as well and the bad things. This is a calcaneal beak fracture after 6 Shockwaves. She's doing much better. She had a calcaneal fracture in kind of the beak in the front. And those are hard to heal, but it did feel better. I can still see the fracture in that area, but it's feeling much better. And then a Swift number 5 with a 3-month follow-up. Okay, so that was my Tuesday. Going another day, this is a day on a Friday. Remember, Friday I do nail care first half of the day, and then I do normal patients in the afternoon. This day I was kind of working on, in April, it's Foot Health Awareness Month, so I did reach out to a couple of newspapers. Actually, I had my virtual assistants reach out to them to set up doing some type of article for them or an interview, and I used AI to help with kind of writing that pitch or that article opportunity. Another thing that I'm kind of working on is something called, there's a good website called Mailbox Power. If you haven't heard of that, it's kind of neat. The thing is, they have the subscription. So basically, I think you pay like $100 or $150 a month, which is cheap, and you can do as many postcards as you want if you just pay postage, which is pretty reasonable. So I'm trying to figure out a way that I don't want to do this so much for patients, but I want to do it for referring providers, and kind of giving them a value message. So what I did is I kind of worked on this and kind of looking at, well, what can I give them a value kind of on a monthly basis? And so I had my virtual assistant set up a postcard template that I can just kind of fill in. We'll talk about different diagnoses, have kind of like a diagnosis of the month and share it. And then it'll talk about that, kind of a catchy front, going over a few topics, and then have a little QR code to a video, because I really want them to get to know kind of what we really do and who we are. So having a video that would help them. So these can be modified. The goal I would really like to do is to have this thing set up like the whole year, like have all the videos, all the postcards set up, and so it just really just drips it on these doctors. And I've tried this in the past with like a newsletter. I'll tell you my failures, right? So I tried this in the newsletters in the past. It didn't really work. It was very expensive. So this is a little bit less expensive. I just want to kind of get in front of them and hopefully give them something of value. Okay, so going for the rest of the Friday, this is the afternoon. The MVP patient was a right plantar fasciitis, and they got a cam boot, injection number 2, get a PT prescription, and then I talked to them, say, hey, if this doesn't work in 2 months, we're going to do Shockwave. So she's pretty much ready to do Shockwave in 2 months. But some patients, I find, they just want to try these other things that are covered by insurance first. Another MVP patient was a right nail fungus and wanted to do laser, so they did laser number 1 out of 6 today, and they got the fungal kit. Okay, so this is something that I'm offering to patients as well. Another patient that had left Achilles tendonitis, they decided to get a second pair of orthotics. The sesamoid fracture that I'm doing, that was number 1 out of 4, and that's pretty much the rest of the afternoon on this Friday. Okay, going to a Thursday, just so you have a notion, there was 25. I try to get 25 patients a day, so 25 out of 25. My MVP patient, this was a patient that had a prescription for ketoconazole. I was going to check on Utenza, and they had a left third met and 4 proximal phalanx fracture. So there's 2 fractures, so there's fracture code times 2 in the imaging. So that's an MVP patient. I think it's going to be fine. I don't really need to even see them back, so that's a good one. Next was a workers' compensation for a bad ankle sprain, and I recommended Shockwave, but they had I could use a fracture code for that as well. Okay, so it was a little avulsion fracture at the dorsal navicular, like for the TN joint kind of avulsion fracture there. Next MVP was this bilateral ultrasound gentleman that I've probably talked about him before, but he had Achilles and he had EPAT number 1 out of 6 bilaterally. A couple of other good patients for the day. There was a patient that had a left ankle after an AFO, and then I talked to him about, for his arthritis, to set up on a recurring schedule every 3 months doing Shockwave to kind of help with this arthritis. I find with arthritis, and what I learned at the Shockwave conference is, as we know, arthritis doesn't go away, the bone marrow edema doesn't, but if you do that every 3 or 6 months, so there's one option is you do a series every 6 months, you do a series of 6 sessions every 6 months. Some patients prefer to do it like every 3 months or every month, 1 session, so depending on kind of what they're willing to do. Next was a left wart. I think we just treated that. I don't know why I had that, because I talked to them about Lipizana. Next was a Shockwave number 2 out of 3. Another one that was a good patient was this was interesting. I did a partial nail avulsion on 5 edges of toenails. And that was a lot of anesthetics and a lot of bandaging afterwards. And then a couple of other Shockwaves. There was a number 5 out of 6. This patient, this was the AMP patient. I did a amnio. I had some free samples they gave me, so I didn't charge them for that. And then another was number 2 out of 6. This patient was another Achilles patient, and then a carry flex and a kit for this patient. Next patient was a Wednesday. So I was kind of looking at different ways to use the lectures that we're doing. I'm always thinking about different ideas, but this is when I was going to send out the lectures via email to patients. I'm going to talk about some of the bad things. So I had one Lipizana that worked great. That was in the forefoot and the first med head, and then I have one Lipizana that didn't work so great. This was in the heel region. He felt like he was kind of feeling the same. I think it's good for me to tell you the good, the bad, and the ugly here. Okay. There was also a patient that they said no to Shockwave. I want to talk about this. Patient was 50% better. They're going to wait for a couple months. They said no to Shockwave. So I want to tell you about the negative ones I get as well. Next was a a right plantar fasciitis ultrasound number 1 out of 6, and I'm going to schedule amnio at the second visit. So this was going to be a good patient. And they also got nail fungus. We're due my little kit for nail fungus. And there's another patient. Once again, I offered the laser, they accepted, and I talked to them about doing the oral as the backup. So they're going to do that. So this is the kind of the new way I explain it. Can do laser. It is the safest and not the most effective, but it's the safest. And you can do kind of oral as the backup. A couple of other things. There was a patient with a bilateral insertional Achilles with equinus. Got my Pelto special bilaterally, so bilateral night splints. Next was a number 1 out of 6 for plantar fasciitis, number 1 out of 6 for Achilles tendonitis, number 2 out of 6 for fibroma, and number 5 out of 6 for plantar fasciitis. So those were a lot of shockwaves this day. I think it was because I was on vacation. And so one thing that I'm doing is I'm going over good, better, best. So what this means is, like, when I'm with patients, I say, explain what they have, and I say, okay, I'm going to go over what the best treatment is. In the past, I used to work my way up to the best. What I do now is I start at the best and I walk down. So meaning, for most of these treatments, the best would be what? Shockwave, amnio, orthotics. That's the best. And if they say, oh, I don't want to do that, then I'll step down. Laser with a backup as of oral. Okay, they're going to step down. So I'm going to always offer what's best first, unless they say, well, they don't want that. Okay, so does that make sense? So that's kind of the way I'm doing this, even on the treatment sheet. So I'm not using the treatment sheet as much. I'm going to circle it on the treatment sheet, but I'm really just going to say, hey, this is the best. Do you want the best? For some reason, a lot of people here in Massachusetts want the best. So I think that's also the best for me. Okay. Another thing I'm going to talk about here, this is a Tuesday. So this is one of my first Lipizanas that I did, and this was on the first MetHead. And I think I told you before, but there was a good NPR piece that a patient shared with me about Shockwave, and I did send this out to my whole email list, so it might be something you'd like to do. And I also had a diabetic shoe place kind of reach out to us. They wanted to use our space, and they would pay us like $80 per shoe, per pair of shoes. I'm just not sure the juice is worth the squeeze if we have the time in our office to do something like that. So, and then the other neat thing from the day is I made some posters for Shockwave. So if you want my posters, let me know. But there's a couple of posters that kind of explain how the Shockwave works. Okay, so some of the MVPs for the day: Achilles tendonitis, number 1 out of 6; fibroma, number 1 out of 6, with EBM for the fibroma, EBM cream. MVP was a left, fourth, and fifth toe and fracture, and they got a prefab insert and a cam boot and the fracture code and all those things. Next was a peroneal tendon, number 4 out of 6, and they got some calluses, and they had a spicule, and I'm going to set up a matrixectomy, so that's kind of a good patient. Second Met, number 2 out of 6 for Shockwave. A plantar fasciitis patient said no to Shockwave. Okay, I offered it though, but they said no. And then the other patient was right wound. So this is the patient that I've been doing the bilateral Achilles for. So he had a wound initially, and now he's doing the Shockwave. He's already seeing improvement for this. So this was the day for a Tuesday, and I also did one other Q-Tenza and some other types of treatment. So I'm trying to go over more of the MVP patients and the way I'm thinking about things. So that is the day. I still have a couple of these sheets going here, so I'm not going to go too long for you. But once again, if you are interested in implementing, I put a little on our website, Podiatry Practice Mastery, a little audit. So if you want to audit your practice, kind of see how you are doing at implementing these things to get you to the $2 million mark, let me know. And if you want to be part of a small group, kind of implementation group, how to do this stuff, let me know. Happy to help. Okay. And also any questions. I always like it when I do these audits or doctors ask me questions, because that gives me more ideas to share information for on this podcast. Okay. Once again, thanks for listening. Talk to you soon.